Good evening, doctors. Welcome again. This is our Neet PG test series 21. The metabolic derangement in a congenital pyloric stenosis is hypochloremic alkalosis. This is hypochloremic alkalosis. Okay, now a lady with a cold intolerance and hoarseness of voice was detected with cardiomegaly. Investigation to be done to know the cause is echocardiography. Okay, now during endotracheal ET tube intubation by right-handed person, laryngoscope is held by which hand? It is mainly held by left hand. Okay. Now, a randomized trial comparing the efficacy of the two drugs showed difference between the two with p-value of less than 0.005. In reality, however, the two drugs do not differ. These, therefore, is an example of type 1 error alpha. Okay. Now, a non-HIV positive patient is admitted in an isolation ward after an abdominal surgery following an accident. The resident doctor who changed his dress the next day found it to be soaked in blood. Which of the following would be the right method of choice for discarding this dressing is pour 1% hypochlorite dressing material, send in incineration and appropriate bag. For fourth option is it. This is fourth. Like 1% hypochlorite dressing material sent in incineration appropriate bag. Okay. Now sixth, a patient has bilirubin 0.9 milligram per deciliter, elevated SGOT PT. It's 1500 to 1600 HBs AG positive, anti HBC IgM negative, anti hepatitis E IgM positive. Patient has chronic hepatitis B and hepatitis E superinfection. So guys, now seventh, the following is the true for mycoplasma except there is no beta lactam group antibiotic. There is multiple binary fission, can grow in free cell culture media, require sterols for growth. Now, mid-systolic click is heard in a female. Pathology seen in mitral valve is Myxomatous degeneration. Okay. Now, the most frequent congenital laryngeal lesion is laryngomalacia. Okay. Now, labyrinth artery is a branch of anterior inferior cerebral artery. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you once again.